Edo State Deputy Governor Omobayo Marvelous performing his first official duty of a 1 megawatt solar power project at the Nigerian military base hospital, Benin City. The Deputy Governor, who represented Governor Godwin Obaseki, while speaking on the implementation of the project, stated that the cost of energy, when reduced, will go a long way to help reduce the running cost in the facility, as it will save the cost of diesel and reduce the burden.
I witnessed the first one and I said working optimally. So I have no doubt at all in my mind that in the next 60 days we should be close to commissioning the place or less. So it's a good one and it's very laudable. Like I said, this should be one that we extend. We have to extend it to all the local government channel. We have to sit down with them and see how we can design. But all of this, like I said, it's a continuum. Government is a continuum. The governor, he has a very good design. And he has gone more than 70%, but I'm sure he will finish well and will continue from where he stopped. So that is it for me. I want to thank all of you.
The Director of Military Hospital Benin, Brigadier General Pauline Olubumi Aborime, while thanking the Edo State government for their prompt response, identified poor power supply as one of the greatest challenges facing the hospital, stressing that they have explored all forms to ensure they have constant power supply, having written to the military authority meant to discuss and interact with the Edo State government to see how to prioritize power.
Just like you said, I'm not into the power sector, so I don't know all the details, but what I understand is that we'll just be paying for what we use, so that makes a lot of sense. It's going to reduce wastage, which like I mentioned earlier, the Nigerian Army actually has a policy on energy as well to curtail wastage. So if we have the power, but that we are just ensuring that there's no wastage, that makes a lot of sense. So once again, I thank the Commissioner for responding to us, in as much as we're also expecting BDC and all the other people that we've interacted with to ensure that we have power here, but that we're going to be getting something practically nearly immediately. That's a lot. So we are really very grateful to the Edo State government, and definitely to Mr. Ike, who I also met recently, who also tried to explain to the best of my comprehension what it's really going to be. So I look forward to having this electricity as soon as possible.
Also, the Commissioner for Mining and Energy, Inaugural, highlighted the significance of providing consistent electricity to healthcare facilities, particularly for essential services like maternal care. The contractor in charge outlined the project's timeline and scope, detailing plans for the installation of approximately 2,000 solar panels, stating that the project has the potential to significantly augment the hospital energy capacity and reduce operational costs.
She have the passion, she have the drive to support the healthcare service, and we see a lot of our Edo people coming here every day, especially the pregnant women, every day on daily basis, and we cannot afford to see that coming here there's no light for us and all that. So governor said, okay, go ahead and make sure they have constant electricity so they can support the healthcare service.
To start the installation, first this whole place will be cleared out. Once they do the grading, then we'll get ready to start doing our post and start installing the panels. The plan, like I said earlier, we'll probably shoot for installing close to 2,000 panels.
The Deputy Governor, Omobayo Marvelous, reaffirmed the commitment of the Governor Obaseki administration to enhancing healthcare infrastructure across the state, emphasizing the need for collaborative efforts between the state government and various stakeholders to replicate similar projects across all local government areas of Edo State. Best Orator reporting for BTV News.